Next thing we're going to talk about is implant incision location. A lot is made of implant incision location because the United States were very concerned about scars. Nobody wants a scar. Plastic surgeons understand that, and we certainly try to get the best possible scar, but sometimes scars are a necessary trade-off for a good operation. In breast enhancement surgery, there are typically 4 recognized incisional approaches. The most common one used in the United States and the world is what we call the inframammary approach, which is an incision in the crease of the breast. From my perspective, that approach offers a straight shot at doing the dissection and gives the surgeon the greatest degree of control over creating the space for the implant. A second popular incision location is around the nipple. That's called a periareolar approach. That incision is popular because it does not have a scar that is potentially visible under the breast. Obviously, depending upon the size of the woman's areola, that incisional approach may or may not be practical. If she's got a really small areola, you can't get any implant of any size through that, so that approach can't be offered to those patients. A second thing about going periareolar is, by definition, you are dissecting through breast tissue. Breast tissue, because it has breast ducts, that's how the milk leaves the breast, is connected to the outside world. Anything connected to the outside world has bacteria in it. So, in theory, you are increasing the potential for bacterial contamination of the implant when you go periareolar. Do I go periareolar? Absolutely, but I certainly make sure that the patient understands that there is going to be most likely a slightly increased chance for problems related to the bacterial contamination. That could either be a slightly increased chance of what we call capsular contracture, hardening of the breast, or a slightly increased chance of losing the implant to infection. So, provided you're informed about the pros and the cons of an incisional approach, such as periareolar, you can make a decision based on, the known facts. Now, there are 2 other incisional approaches that are what we call remote access incisions. One is through the armpit and the other one is through the belly button. Now, the armpit incision is certainly popular. It's more popular actually in Asia, and that's where the incision is made high in the axilla and the implant is placed from that direction. Due to its location and the fact that it's a remote access incision, the most popular implant used for that approach is a saline implant. You can get a silicone gel implant through that incision, but not a particularly large one because of the logistics of placing the implant. Last of the remote incisional approaches is through the belly button. Through the belly button is touted by some surgeons as leaving no visible scar on the breast, and certainly that is true. It is essentially a blind approach, however, where the incision is made through the belly button and then a scope or a tube is passed under the skin and under the breast. Then a saline dilator implant is then passed under the breast, and the pocket for the implant is created by inflating this dilator. And then a saline implant is placed, that is the so-called permanent implant. Obviously no implant is permanent. It'll be replaced in a woman's lifetime. Now, proponents of this surgery will go to great lengths to tout the scarless aspect of it. I don't offer this particular surgery because I just feel I am sacrificing a greater degree of control over the creation of the space for the implant than I would like to. Last of the incisional approaches that really isn't an incisional approach, it's just done kind of in conjunction with another operation, is women getting a tummy tuck and having the implants placed from underneath the abdominal wall skin. Once again, that approach offers trade-offs, and I'm not a big fan of that incisional approach either, since it tends to violate the inframammary crease and potentially causing implant malposition.